Good afternoon. Welcome to Embracing Change, Talking Through Trauma. And today, my guest is Chandler Moore. And Chandler actually owns a Pilates studio and she resides in Springfield, Missouri. She is also a Pilates teacher, a Gyrotonics teacher, and a personal trainer. And he is in the process of writing some online curriculum, and it's called Moving Through Menopause. And we're here today to talk with her about um, her program, but also more specifically in detail about menopause. Welcome, Chandler. Thank you so much for joining me.
Thank you for having me, Tami. I'm so excited to be here.
And let's first with did I cover everything in the introduction? Is there anything else you want to say about yourself before we get into conversation?
I mean, the list goes on and on. When you've been in this industry for 20 plus years, the list of continuing education courses that you've taken and all of that, it starts to get, it's just like a laundry list of different things. But yes, you hit all the highlights, I would say, for
Okay.
sure.
Okay. Can can you tell me like what has really sparked the interest in menopause for you?
So that's a two-pronged answer, I feel. For professionally, I am starting to see these symptoms come up more and more in my clients. I have clients that are entering into perimenopause. I have some that are already through the transition and are postmenopausal. And I have some clients that were thrown into menopause instantaneously due to illnesses. So that part of my practice has obviously um, driven me to just gain more knowledge and try to understand what's going on. And then my own self, being 45, I'll be 46 in February, I'm starting to have some perimenopausal symptoms myself. And it is laughable the the misinformation and the lack of information. And so it's kind of fueled this energy inside of me just to try to provide as much support for women as I can so that we can normalize what is going on. It's just I can't, it just blows me over sometimes whenever I let myself think about it too hard, like just the misinformation and the or lack of information. So that's kind of the base where I'm at, and I'm still learning. And but I've started with a really solid base and foundation, and reaching out to professionals for guidance.
I'm glad to hear that. Now, when you talk about illnesses, um, I'm just going to say this to you, and I am a breast cancer survivor of 18 years. Actually,
Mm.
soon to be, actually, it's 19.
Yeah.
And when I had breast cancer, there was no conversation around like the side effects because I was one of those ladies that shift right into menopause, period.
Yeah.
And I was 40, I guess I was 48 when it happened. And so I can tell you that looking back on that experience, I would tell you most definitely was a very traumatic experience for me. Not necessarily the breast cancer, but what was happening with my body
Yeah.
after I had breast cancer. Do you feel that is something that you see in some of the women that you've worked with as far as like trauma? I mean, because we don't talk about it, and so and I don't want to use the word trauma, but it's still traumatic for you to
Oh,
your bodies to go through something like that, especially when you don't know.
exactly. And it's so layered because it's a lot of fear. You're recovering from the shock, and just, you're hearing the information, trying to process the information and then make sense of it all. Then, you have to start, in your case with breast cancer, you probably had some sort of surgical procedure, being a lumpectomy or mastectomy. Sometimes it's double mastectomy. Then some women, if they opt to go into reconstruction right away, or do they take a pause and just do one thing at a time? You know, there's those decisions that have to be made. The other one of my, she's actually more of a friend and colleague than, she's not a client, but she was thrown into instant menopause from ovarian cancer.
Yeah.
So
Oh,
there's that layer as well. So it's really hard to be a lady.
right. And yet, but the one thing I want to lift the work that you're doing, there is resiliency on the other side of it.
100%.
There is resiliency on the other side of it, but I think that having the awareness and being proactive like you're doing and having a voice to talk about menopause and say, look, because you're in the beginning stages of it. And so to talk with other women and talk with women who've gone through the process and say, okay, but a few weeks ago, I had another lady who is, she wrote a book and it's called Navigating Through Menopause, and her name is Karen Serrano. I think I've got her last name wrong, but anyways, it was very interesting because we had the conversation around that about the side effects and the symptoms around it. And I know that you've had a lot of experience along those same things. What are you seeing in your clients?
Well, so for instance, the one particular client, she opted to go right into reconstruction right after her surgery. And you're obviously very limited with whenever you have expanders in and trying to negotiate around, but then also still needing to move so that you're supporting the shoulder joint and the chest tissue to keep, blood flow and fluid moving. Another one of my clients, she her skeletal structure, she's only in her early mid 40s. She's a breast cancer survivor. I'm sorry. I'm still in that demographic. I stayed in that demographic. Am I on track with your
No,
question?
we can still talk there. That's fine. Yeah.
Okay. Sorry. I kind of like maybe
It's
crossed
all right,
my
Chandler.
wires. But she had her skeletal structure due to all of the medication from her breast cancer journey. It threw her into having advanced her skeletal structure about 20 years. So she has a
Oh,
lot of issues around osteopenia into osteoporosis. So the way they measure that, is it's a very
yeah.
interesting way they measure it. So she was having difficulty moving due to that. And, she wore a pair of heels to a wedding and it threw her back out for weeks, like little things like that. Just the recovery time is a lot more lengthy. But then I try to keep it light and not take ourselves too seriously so that we can be playful with it and have fun, because some of the symptoms, like that's the other thing, like with my non post pink ribbon or breast cancer clients, it's just the comedy of errors that come up, like when we start talking about just the random symptoms that are menopausal symptoms or perimenopausal symptoms that you have never heard of, like itchy palms. Like my palms itch for no apparent reason. Okay, like that's just one of the weird ones. The other ones are sleep disturbances, like, and that has kind of brought up sleep disturbances, like do they have sleep apnea, or is there a sleep issue going on, or is it a hormonal issue that's causing the sleep issue? So like it's like what came first, the chicken or the egg? One thing I had thought to tell you as I was like mentally preparing for this was I'm an older mom. Like I had my children at 31, 33, and 35. So at 35, you're given the advanced maternal age or geriatric pregnancy, which was lovely to hear that. But because I was postpartum at 35, 36, 37, because I nursed for quite a while, I think that I was kind of going out of postpartum symptoms right on in to the perimenopausal symptoms. And so it again, it just gets very layered. So I had kind of started to accept like my poor sleep quality as just my new normal. Like this is just the way that it is now. And it doesn't have to be that way. Does not have to be that way.
Yeah.
So
And it's interesting that you like, because we obviously both of us know from being in the health and wellness fields that sleep is critical, whether you're a nursing mom or like, an older person as well. And I think that, one of the things that I did not mention in the beginning, but the title of your program is called Moving Through Menopause. And that's exactly what you do is you move, but there's so many ebbs and flows with it. And when we talked prior to us coming on the air, we talked about all of the things that like thinking about all the things that are associated with sleep and how it dysregulates our bodies if we don't get the quality, especially the quality sleep that we have. And it's so critical, so critical.
I have to give credit to my client. Her name is Mindy Letterman. She is a nurse and she works in the cardiac unit at our local hospital, one of our local hospitals here in Springfield's Cox Health. And she is the one that has taken the front and center in educating me on sleep apnea because she works with patients all throughout the night and she watches them not
Yeah.
sleep or not breathe while they're sleeping. And she had this saying that just like hit me between the eyes. And it's sleep apnea is the grim reaper that gives the credit to his friends, like uh arrhythmia, high blood pressure, stroke, heart attack, and again the list just goes on. And then not to mention if you're not sleeping well, and that just kind of, you have this vicious cycle of inflammation, your joints never feel good, you can get, there's plantar fasciitis is another big symptom of poor sleep quality. And so anyway, it's just it's so simple, but yet somehow in our current culture we have made this it's gotten very complicated.
But think about what you just said, because, and I'm just going to say this because we glorify people who can survive on 3 hours of sleep.
Oh yeah.
And usually when you see people like that, they're perfectionists or they're overachievers or they have all of these other like underlying things that could be masking it. Oh, I don't need that much sleep. I'll be fine.
It's
And then
we
you find and then you find that they have health problems later, maybe not right then, but they like hypertension and all of those kinds of things. I mean, to me, it's this big, like it's like a big cycle. Like we can talk about it, but yet sleep impacts so many other things. And I mean, the for sleep quality. But the one thing that I think is really like how it impacts our body on so many different levels. And when you see like the country right now, where there's like such high obesity rates, and it's I think that's probably one thing that's definitely contributing to it. But it's like I just, and I don't know what the obesity rates are in the state of Missouri, but where I live, Michigan has very high obesity rates. But yet,
Oh, we're up there. We're way up there too.
okay,
Missouri is for
but
sure.
one of the things that I think too it also impacts is that people's ability to sustain exercise.
I
I,
mean, yeah.
I mean, like when we talk about like the importance of why it's important to strength train and all these other things. I mean, and we talked a lot about those kind of things. And so it's like if you're tired, you don't want to go to the gym and you don't want to come to Pilates, or if you do, you're not going to be able to be focused. And I mean, there's just a variety of things, or your breathing can be off.
Yeah.
So yeah.
I mean, I think it's human nature to some degree. Like the hardest part of any workout is just getting there. Or like I think I saw a meme the other day that said the heaviest weight you lift at the gym is the front door, you know, just getting in there.
Yeah.
So yeah, it's a lot of mindset. It's a lot of our um our areas, Tami, are very seasonal. right? We're just not as active in the winter. It's not as accommodating to get outside and that sort of thing. So that works against us. And it's, dark right now this time of year. It's dark at 5 o'clock. So that doesn't do us any favors either. It does have to come from a place within, to find that internal motivation and that want to and that desire. It also helps to have support and accountability.
Yeah.
I mean, those are just, I'm just as guilty as the next person. I need to be held accountable too. So yeah.
I understand because, like I work with a personal trainer myself, and like I had to miss, and she was gentle with me, but she said, we haven't seen blah blah blah, and I'm like, I know. So,
Yeah.
but and I just think it's really it's important, especially for women, if you're going through menopause, you've gone through menopause, for strength training.
Thank you. That gets us right back on track with what I really wanted to make sure that I drove this home, is that it is never too late to start. It is
Mhm.
never too late I mean, I think that's where a lot of the hangups can get in our way, is that, well, I don't have any experience. I've never done this before. I don't want to get bulky. Like I'm in, or there's an, I'm not gonna, there can be an intimidation factor there. I totally understand that, especially if you are in a facility where it's a mixed demographic and there are people there lifting really heavily, and if they're loud and letting everybody know that they're lifting heavy, that can kind of be a bit
Yeah.
intimidating. Um so a part of my motivation and um desire to support and promote this is that women have that confidence to walk up to the line, where all of the dumbbells are lined up, and they can walk up to a weight and know exactly what to do with it.
Yeah.
And then that will only help, motivate whenever they start to, have that their own internal confidence, and then of course building the strength that goes along with it is just a bonus.
Well, and I think too that working with somebody, personal trainer, a Pilates instructor, gyrotonics teacher. I mean, I
Yep.
think that sometimes I mean, not everybody can afford it, but having an understanding of what and how to use the weights and what you need to do for your body, because then you can get, we're not going to go down that big rabbit hole, but a lot of, like you talked about, not bulking up, but you also can see and hear women at the gym talking about, you know, like the diet culture and the whole 9 yards. And I think that there's so much, it's not just about like the lack of sleep and the lack of eating and the lack of, eating healthy. I mean, it's big cycles is what it is. And it takes a big firm effort to eat and exercise and sleep consistently.
And I think too, we have to change the narrative of women, their mindset. You have to get out of the mindset of like, oh, I'm just exercising to be skinny. You have to exercise to be strong. That's where the narrative needs to shift, because up in, again, throughout the, I was young then, but the 80s, it was all about aerobics, right? And like the Jane Fonda workouts. Like I grew up watching Jane Fonda. That's my like idol. My mom had a basket next to the television that had all of her gear, like her ankle weights and her leotards and her tights and like all in the VHS, tape that she'd
Mhm.
plug in.
Yeah, yeah.
Anyway, but that ultimately is women have to get to, not only do they have to just like step into this mindset of working out for health and building lean muscle mass to improve the quality of their longevity, right? But then they have to leave that the effort, 30 minutes on the treadmill isn't going to do you. I mean, it's building cardio strength is 100% good job, right? Absolutely. But it has to be paired with the anaerobic workout as well as the aerobic workout. There's so there's just a whole lot of education around this, and so it's a lot of demystifying kind of leaving behind old information that's no longer relevant or serving, and then stepping into uh, the program that will serve, that will help them build that muscle, so to speak.
Yeah. So quite frankly, I think it's important to say that whether you're in the beginning of menopause or maybe you're postmenopausal, lifting and strength training is critical to help
Critical.
combat osteoporosis, osteopenia, and I think that like there's just so much. I mean, there's so many things that we could talk about because I I lived probably 3 days a week. And I
Yeah.
mean, I'm not everybody. I mean, I'm just saying that is what I choose to do, but it's just so important. So if you are listening to the podcast, it's where we're talking to all women, not just
Yeah,
um,
those of us in the movement world already. Yeah, and I will also say it really helps to have, like, once you if you do go choose to go to a place like a gym or your local YMCA or whatever the case may be, join my course. The community aspect is, like, I have witnessed so many people meet brand
oh
new,
yeah,
and then they're become friends.
yeah.
And it is just, that warms my heart. I love that aspect because we are women, as you know, we are community. That is, like, we cannot help it. We are the glue that usually is what, you know, pulls people
Pulls families
together,
together.
pulls
Yeah.
families together. We do the hosting, we do, we just, that's just, that's part of our
And,
role.
and what about, we also talked a little bit about like resistance training, like,
So resistance training it can look like lifting weights, a pair of dumbbells, barbells at the gym, machines, what have you, Pilates,
mhm.
anything that gives you a source of resistance is going to help build that lean muscle mass. It's going to help guard against, build, or basically just help support your bone density so that you can have that longevity and quality of life. And then I will also step into a little bit as well of impact training as well. Like, your body has to know how to absorb shock. It has to know how to, like in a jumping type, like your joints need to know how
Yeah.
to rebound and absorb that force, and that will also build that coupling, that muscle mass, as well as the overall bone density. So I don't know. I feel like you have to find something that is some sustainable for you. So
Mhm.
whatever that looks like, if it is a Pilates practice, if it's a strength training practice, if what have you, but you have to also, it helps if you like it, if you can like it, if you can let yourself like it, that will only serve you to maintaining a structure, a routine, and a structure.
So Chandler, you also wrote a program, the strength training.
Yes.
Can you
Oh,
talk about it? Oh,
sure. So the strength training starter kit is what I named it, because again, I'm trying to remember what it was to be brand new to training and not remember what I know now. And there's also so many different ways to train, but in this program, what I'm aiming to do is just start with a very blanket, informative, like, base of, I'm designing the workouts around, like, for instance, your push muscles. Your push muscles are going to be your triceps, your shoulders, and your chest. Your pull muscles, the pull muscles are rough, just, I'm giving a gross overview, but your pull muscles are your biceps and your lats. And then I'm still kind of working with leg day. Leg day is a big one. Usually wipes people out because it's such a large portion of our body. But in my own training, I break up my leg day into my anterior chain, so the front, mainly quads, and then the posterior chain, which is glutes and hamstrings. And again, this is I'm speaking, trying to speak as generally as I can.
Yeah.
But basically front side versus back side is pretty much it. So you can break it down into either a 3-day a week training program or a 4-day a week training program. But that's where I'm starting with the education behind it so that people have a sense of what they're doing. Sorry, that's Stevie, by the way. So that they don't just walk into the gym, like, because I've seen it happen. I've seen a woman walk onto the weight room floor and her eyes just kind of like, where do I start? Because there's all these machines, right? And so
Yeah.
let's start trying to like go around and start moving the different machines. And maybe they're organized at that facility and maybe they're not. A lot of times your equipment will be organized for what I just said. Like you've got your push muscles here, you've got your pull muscles over here, so you can kind of stay organized. But that's where I decided would be like a really great starting point so that you can just kind of get your head wrapped around, depending on, some of us have more anatomy knowledge than others, and maybe you have some anatomy knowledge, but it's really old. Like when's the last time you took your anatomy and kinesiology class? I don't know. But I thought that would be a value so that women would be able to understand the why, not just, okay, I'm going through the motions, but there's a why I'm doing this.
Yeah. And Chandler, is this open? Um, so you're going to be offering this online, correct? Too.
Yes. So it'll be, we're starting kind of, again, very traditional, very stereotypical, starting in January. I'll be dropping the first week's content. We'll have our first live call on January 15th. Will be our first live call together. I'll drop the information the week before so that people have a chance to kind of go through and look at it, bring questions to our first call. They'll get the resource list of if so. Oh, that's the other thing. So it'll have a 2-pronged option. So if you want to work out at a gym and go to a facility, there will be little videos and names and prompts to go with the movements that you would then do at a gym. Or if women are more comfortable working out at home, there is a resource list that I will give them with links to basically be able to do the workouts at home with smaller light equipment like bands, a small like ball, and some different, like what we would call like Pilates props or accessory pieces. If they don't have anything substantial when it comes to weights, they will have to invest in a system of weights up to 25 pounds. So there is a little bit more investment in that route. But if people feel more comfortable, and if it's more sustainable and they know they'll do it at home versus having to go somewhere where they don't feel comfortable and it's intimidating, then I wanted to have both options. So yeah.
Well, and I think sometimes too, having those options available for them is a really nice, like, because sometimes people are intimidated, especially if they're stepping into working out and they're not used to it, or maybe they've lost weight and they're wanting to get into it. That's why your program would be ideal for them, wouldn't it?
I mean, pretty much, yes, because again, we're starting from the very base, like the basics.
Yeah.
And if someone has a little bit more experience, you can absolutely still get
Sure.
something out of the program. You're just going to probably up your weight amount. One of my little like taglines in the course is like, if your purse is heavier than the weights you just went and picked up, then we have to talk. We either need to,
But think about it. How many women hurt themselves from carrying that
exactly.
purse?
And then again, it's always asymmetrical too. So I see a lot around that. So I was definitely, I've seen it enough that I have to address it in the course.
And also carrying a child. If you've got
Yes.
a toddler easily can weigh 25 pounds.
Oh, yes. Whenever you're in those years and your hips all hiked up all the
Yeah.
time, for, yeah, you're all cattywampus.
Mhm. And then, so when is the moving through menopause program going to open?
The moving through menopause, I'm going to stagger it just a little bit later, probably starting that one the 1st of February.
No,
Yeah.
this is, and how can, and I just want to say this, all of your information in regards to like how people can get a hold of you will be in the show notes. So we don't have to go over
Yeah.
all of that. Yeah, yeah. So, is there anything else, Chandler, you'd like to add that we've not covered? Because I took notes before and I have them right here in front of me. I think we've covered everything that we had talked about.
Well,
Um,
I guess just maybe another little add value is, I did not start lifting heavy until I was like 40 and a half.
hmm,
So if that helps support someone else, I haven't
mhm.
like, I haven't spent all of my 20s and 30s. I mean, all of my 30s, I was either pregnant or postpartum. So I wasn't really hitting the gym, pumping the iron, then either. And so it just was when my youngest was in that like 4.5 to 5 years old range, that I was able to kind of like come up for air and start paying a little bit more attention to my own health. That way I can, be around for a long time, because, like I said, I had my children a little bit later. I'm going to be an older grandmother someday. And so I hope that would um soothe or just help support someone else to know that I didn't really like lean into this until I was already in my early 40s. So I'm 45 now. Like I said, I'll be 46 in February. So I don't see any reason to stop. And I just want to again support others to join me in this. And because I only feel better.
Yeah.
I only feel better.
So to piggyback off what you just said, I feel it's important that I also chime in here. So I have always done something like Pilates, yoga, and I lifted and I taught classes in a gym setting, but I also lifted when I was in like when my daughters were like young. And it's only been in probably the last, let's just say year and a half that I've really like really seriously gotten serious about like personal training is on my schedule and I lift. And one of the things that I have to say that I wasn't shocked, but I was surprised because here I was a Pilates instructor and I've taken care of myself. And when I went to work with the personal trainer, she said, "What's going on with your arm?" And it was my breast cancer side. And I've never had like, I didn't feel like I ever had like a ton of scar tissue. But anyways, long story short, when I first started lifting, her first name is Katie, and she is, anyways, I was lifting 6 pound weights, like, and I could do like an overhead press. And as of now, lifting a year and a half later, I am lifting up to, depending on what we're doing, the exercise and how, because I won't over fatigue. Like, yeah, I mean, I will fatigue it, but I won't get to the point where I'm going to be sore, sore,
Yeah.
sore. Um, 20 to 25 pounds is what I'm
Oh,
doing.
Tammy, that's amazing. That's
So,
heavy. That's
yeah.
really heavy.
Anyways, my point in saying that when people ask me, and I'm just going to be very upfront and very honest, I have two young grandsons,
Mm.
and they are 5.5 and 2. And I want to be around and I want to they're very busy. And so I need to have the stamina to keep up with them. But then the other piece is I've had years and years and years of my own education kind of trajectory here a little bit differently, but I've worked with children for probably 40 plus years. And so
Yeah.
I'm creating programming around that. Well, I have to keep my stamina up if I'm going to be worried because everything that I'm doing with them is movement based.
Yep.
So yeah, and so I
Absolutely.
just can't encourage women, and I actually am working like privately with a small group of women who have lost weight and getting back into it themselves. So I would just encourage you to check out what Chandler's got to offer because and I'm sure it's going to be amazing. And you know your stuff, Chandler. So
Well, I again, thank you so much for giving me an opportunity. This is again new in my world of and kind of branching out professionally. So I thank you again so much for having me.
you're welcome. So thank you, and I will let you know when we're off camera. Then it'll be posted and all those other kinds of things. But thank you so much for joining me today. It's been a wonderful conversation. So